Before we get started, I would like to also introduce we're going to have two speakers this afternoon. We're going to be hearing about the updates to very newly minted guidelines that have just come out. We're going to be hearing from Dr. Prakash. Again, he is a board-certified cardiovascular disease and internal medicine doctor, as well as an associate professor at the McGovern Medical School at the University of Texas Health Science Center in Houston. He's going to be bringing us up to speed on what's changed, what's new, and then we're also going to be hearing from Cindy, our CEO and president as well, who's also going to guide us into that survey at the end. Again, please hold your questions for the end if you would, and we will kick it off from there. So let's welcome Dr. Prakash to the stage.
Hello, everyone. I hope your day has been fun and productive and helpful. What we would like to do in this session is go over some of the ways in which your contributions to the Turner Syndrome Research Registry are moving our knowledge about Turner syndrome forward, and also to highlight how important it is for everyone to participate in this work, because without you, we can't do any of this. So I'm going to present some research updates. If you have questions like about the guidelines, I did talk about those for cardiology in previous sessions, so I'm not going to spend a lot of time on those, but I'm happy to answer questions. You can, I believe, can they still post, or do they need to tell us out loud?
No, we'll have a posting.
Okay, so we'll have the opportunity for you to post more questions at the end if anything comes up. All right, so I'd like to point out that we are an active academic center. We are publishing articles that are going in worldwide to scientists about the information in the registry. These are just a few, actually, of the publications that have come out of the TSRR since 2023. So we had one article about the new and improved research registry. Behind the scenes, we're making constant improvements to make the experience of you as participants and doctors who use the information better. That is more informative, more efficient. And some of these things are actually new to the scientific community, new enough to be published in a journal to show other scientists how to do it. So we're actually changing the way registries work as we are doing this. And this will help other rare disease communities beyond Turner syndrome. We had two articles about skin concerns. So we have a dermatologist group that works with us, and they spend some of our conference time surveying folks. Those of you who were at the Healthy Heart Project last year might have seen the dermatologists working with our Healthy Heart team, and we are actually publishing data on the relationship between skin moles and heart problems in Turner syndrome, which nobody ever thought about before until they did. So that's an example of taking totally different areas and combining them together, which is something you can really only do in Turner syndrome since it involves so many different areas, right? That's a superpower that we have. Another article is about Y chromosome DNA, and a lot of people have asked about Y DNA, and we actually don't know that much about it. What does it mean if you have Y chromosome DNA? Does it make you more likely or less likely to have certain problems? So we looked at the relationship between Y DNA and congenital heart problems like bicuspid aortic valve, and we found no relationship whatsoever, which is comforting news because we had thought that there might be an effect, but we haven't proven it yet. We're still looking. And then we had an article by Dr. Michelle Rivera and her team in PD Endo about health inequalities in our Turner syndrome cohort. So we know that not everyone has access to a Turner syndrome specialty clinic. Not everyone can get regular screening. What does that mean for our community, and what can we do to help prevent some of those healthcare inequalities that we are contending with? So those are some examples of work that's come out in the last year, and I'll talk about current ongoing projects now, but you can see how much we're building in terms of research interest and how this is getting out throughout the world to make our knowledge powerful and help other people. And of course, I couldn't leave out the new Turner syndrome guidelines, which I just mentioned. So these were just published about a month ago. This is what it looks like. There was a large working group and I was very fortunate to be the chair of the cardiology guidelines for the new Turner syndrome guidelines. So we spent about three months working on the guideline preparation, then we had a meeting, and another 3 months writing the guidelines. It was quite a long process. I'm very proud of what we were able to achieve. I showed some of those key takeaways in the earlier talks about recommendations from cardiologists about how often you need to visit a cardiologist. All of those things were new in this year's guidelines compared to the old guidelines in 2016. All right, so I'd like to talk about where we are with the Turner Syndrome Research Registry. As you know, we've been recruiting participants outside here all the last 2 days. I'm pleased to say that we just passed 1,450 enrollees in the registry, so give yourself a big hand. It's gone up by several hundred each year, and we're obviously planning to continue to grow the registry. So if there's anyone you know who's not yet in the registry, please ask them to join. It's very easy to do. We only send surveys once a year. The current version of the surveys is out now, so if you haven't done the surveys in a while, it's probably time to update your information with us. And check your email, because sometimes it goes in the junk, but there will be an email from the Turner Syndrome Research Registry in there for the last couple months for those of you who are signed up. And it has a link to the surveys. Okay, so this is kind of the way we use the surveys to drive research in Turner syndrome. Most of the information in the Turner Syndrome Research Registry comes directly from you in the form of survey data. What this does is, when a researcher says, I want to learn more about Turner syndrome, and this is the specific question I have, we can take all of the answers you provide in the survey and match them up with what the researcher is looking for. If they want to know more about horseshoe kidney, we know which one of you has a horseshoe kidney based on your results from the survey, and we can direct you to that researcher. So that's how the research is driven by the answers you provide in the survey. It's a direct match. And the more information we have about you, the more we will be able to involve you in meaningful research opportunities. And of course, we check those. We make sure that those are real, legitimate research opportunities before we send them to you. And we make sure that we have your consent to participate in research. You can also decline to participate in those projects. Those are completely separate from signing up for or participating in the registry. That's all you need to do, but we can give you, if you consent, opportunities to do these additional studies. All right, so recently, as I mentioned, we sent out the third set of national surveys since 2020. These national surveys have a new and expanded set of surveys in them. So you will notice that there are now 3 major surveys that are in the queue for you to complete. One is on prenatal and early life, that is before birth to just after birth. The other is a general health survey that anyone can fill out. That's on every condition that we know of related to Turner syndrome. And then the third one is called the Estrogen Experience Survey, and that is for a specific call that was developed last year at the conference when we asked people, what are some top concerns? A lot of the questions that were raised were about hormones and what is the best hormone regimen to take? What are some concerns about side effects? So we designed this survey to get some real data that will help us design clinical studies to make hormone therapy better for people with Turner syndrome. That is the purpose of that survey. And for the first time, we have Spanish versions of all 3 surveys, and we're hoping to expand to Spanish speakers this year. So this is the situation. Depending upon your age, you may see different kinds of surveys. So if you see a different survey than your neighbor, it's because you fall into one of these different categories. If you're over 17, an adult, you may only see the general survey. If you're less than 5, you may only be given the prenatal and early life survey. And if you're in between, you may have an option to participate in both. So the most important ones for us are for young children, the prenatal and early life survey, because we really want to know how Turner syndrome was diagnosed before birth or after birth, and what complications happened during the pregnancy and in early life. That's new for us this year. The general survey is an extension of the previous survey that many of you have filled out, but it contains new information that wasn't in the other surveys. So even if you filled out an old survey, it's important to redo the general survey because it gives us an update about your health conditions. So this is how many surveys have been returned so far. And the most important one here is the fact that we have over 170 responses. This is before the conference, and I'm sure it's going to go up. But out of the 1,300 people in the registry, we have a ways to go. So we're going to continue to send out these reminders every couple months going forward for the rest of the year. This is some examples of what information we get from the survey. So we can pull a report on the ethnicity and the age of respondents to the survey. And you can see it's all over the map. One of the strengths of the registry is we have people from 0 to 80 years old in here. Nobody else has that range of Turner syndrome experience. So this is a tremendous asset for people looking to learn what is Turner syndrome like throughout the life, right? These are just an example of people's heart conditions, and I know it's hard to see, but these are all different heart conditions that people might have with Turner syndrome, like bicuspid aortic valve, aortic aneurysms, high blood pressure. We can tell immediately how many people have each condition and which conditions we should focus on. You know, if we're doing a study, we would know how many participants we could have to test that condition. That's really valuable to researchers. And this is the karyotype. So we have, as you can see, majority say mosaic, some a little bit more, but it's about 50-50, mosaic, non-mosaic. That's more or less what we would expect based on what's known, so half and half. And you can see that some people don't know their karyotype, so that's something that we're working to change. We think that everyone with Turner syndrome should know their karyotype and have access to karyotype testing, which is not always true. So we're trying to close that gap, and this will help us find people who need that help. Okay, so the last survey, as I mentioned, was the estrogen experience survey. This is sent out to everyone over age 15. And really what we're looking at here is what is your experience using estrogen from childhood all the way through adulthood. No matter when you started, you can complete this survey. These are the current participants, and you can see that on the right, this is the age in which they started to take estrogen. It ranges from 10 all the way into the 40s. So what we hope to learn from this is what are the indications that people are using hormone replacement for, and what doses and other methods are most effective for you all, because we want to decide if we should look into the potential side effects of different forms of estrogen for Turner syndrome. And we can study that in a clinical trial. Okay, so please participate in our surveys. If you haven't signed up for the research registry, you can do so outside. And if you have joined the Turner syndrome research registry, but you haven't seen a survey for a while, please check your email, because it's likely that there is one in your queue. All right. So I'm going to talk about some other studies that came out of the registry that are using your data, and some of these involve genetic information. So an example is a study from Michigan State by Dr. Rebecca Nickmeyer, who provided these slides. This is about thinking and learning, a question that many of you have asked about. She's doing a study of neurocognition and Turner syndrome, and she's looking specifically for people who participated in the Oregon Health and Science study and had their exome sequenced, because she wants to have their genetic data and also test their neurocognition. So if you had an exome sequencing done at OHSU, Dr. Nickmeyer wants you to contact her to participate in this study. You have to be in the research registry in order to join. So the idea is that this is all done remotely. So she has set up a cognitive study that you can do on your computer. And then she is going to take that cognitive study and match it to your genetic information that we now have inside the Turner Syndrome Research Registry. It's linked to your registry ID. Okay, so this is what you need to do. We've already sent out an email from the registry to eligible participants who we know have genetic data. So check your email and follow the link provided. These were also sent within the last 2 months, and you will receive some compensation for being in the study. Okay, so that's an example of using the registry to identify participants with specific characteristics that we then ask to participate in a detailed research plan. And that would be an example that we could use for other kinds of conditions in Turner syndrome. So I'd also like to tell you about some research that we did at the conference last year in the Healthy Heart Project. You may remember, if you participated, that we asked everyone to get an electrocardiogram in addition to their echocardiogram and ultrasound. So we wanted to see how many electrocardiograms have abnormalities and what those might mean for people with Turner syndrome. So ECGs are the most common screening test for heart disease. And almost everyone who's been to a cardiologist has probably had an ECG. The question is, if we find an abnormality, does it mean different things in Turner syndrome? And can we use it to help decide how to care for people with Turner syndrome? So this is, in this situation, people who had echocardiograms at Healthy Heart also underwent ECGs. And so what we did was, we looked at the echo results to find out if people had heart problems, and we compared those to their electrocardiogram results. So we had 118 participants. The ages were 5 to 76 years old. 103 participants had both electrocardiograms and echocardiograms and were enrolled in the study. They also filled out surveys about their health history for the Healthy Heart Project, which we used. And then we analyzed the ECG changes, and we wanted to find out, are they associated with specific heart problems in Turner syndrome? So what we found was that 1 in 4 participants, 1 in 4 at last year's conference, had changes in their ECG that are not normal. The most common changes were 2 fairly common types of changes that we see in people without Turner syndrome. They were called ST depressions and T-wave inversions. And these changes were common in people who had abnormal echocardiograms. So they tended to match up with people who had abnormal structural problems with their hearts. And the most common problems were an aneurysm, or a dilation of the aorta, or coronary artery disease. And we also looked at the QT interval, which is known to be increased in some people with Turner syndrome. But fortunately, we found that very few had these QT abnormalities. So this is an example of, with the highlights of abnormal ECG waves in somebody with Turner syndrome from the conference. And we saw this was the most frequent change that we saw. So what we saw was that heart problems are, again, incredibly common in Turner syndrome. And the other thing that's not here is that when we asked people if they knew about their heart problem, about 1 in 5 people with an abnormal electrocardiogram or echocardiogram weren't aware of their heart diagnosis. So it's super important to get screened, even if you don't think you have a heart problem, because we are finding things. And we don't yet know what all of these changes mean. So if people enroll in the research registry, we can then link your information to your registry record and follow you over time to find out what this might mean for other people with Turner syndrome. Because diagnosing problems early can prevent future complications. And this was, of course, part of the Healthy Heart Project, so we all know that Dr. Silberbach originated this, and we're carrying on this tradition. And we would ask everyone to participate again in the Healthy Heart Project next year, because we plan to carry on these activities. And let's see. Oh, do we have a... We have a question. Are we going to the VVox? Okay. So these are questions sent in. What is the best specialist for adult hormone replacement therapy? And who should ideally manage this? Good question. So most of the time, hormone replacement therapy is managed by either gynecology or endocrinology. The choice is really up to your comfort zone. Some people have a gynecologist as their primary care physician. Other people have an endocrinologist. I think it really comes down to who you trust and spend most time with and feel more comfortable with. There is no right answer. Many gynecologists are perfectly comfortable providing HRT care, but it's got to be an individual kind of decision. Most of our Turner syndrome patients in our clinic are followed by endocrinologists, and so they'll be the ones to do it, but you have many options. Turner syndrome and empty sella, any connection between the two. There is no definite connection between Turner syndrome and empty sella. There are, of course, other hormone changes that occur, like thyroid problems, but that specific one I'm not aware of. Let's see. Do we have anything else?
So people should be putting their research questions in now.
Yes. So please submit research questions that you want to have us answer. We'll go through some of them, and if you have any more questions, you're welcome to put those in too. I'm done with the part that I had prepared to say. So.
Of course, we really want to thank Dr. Prakash for all of his efforts, and like he said, Dr. Silberbach for starting the registry and the different projects that have led to all of this. My part in what I do is we meet with the Scientific Advisory Board once a month usually, and we have had some wonderful researchers contact us and wanting to use our data. And so each month we go through their applications, and not only do we look to see how they fit with us, we really look to see how we can help them. So for instance, they might send a survey over after a while, and it's kind of complicated, and it asks things in ways that we normally don't talk like that. And so we try to help them correct that so that it makes sense to the population and you answer the way that they're hoping. So for instance, it might say, do you have ovarian failure? And people would say no, but they take estrogen. So in a lot of ways it was confusing. And when he first started, he talked about, where the questions come from and how moles could be connected with cardiac issues, and that's unusual. I know when my daughter was young, I asked if ADHD was common to Turner syndrome, and I was assured it was not. And over time, enough of us found that was a struggle, and so they started to research and find these connections. And the same thing with lymphedema. I remember asking, and everybody just said it's not really related and it'll go away. So if there's a struggle that you have and something's not working, just feel free to contact our office or bring it up on a Facebook page, because we monitor those, and it does give us the ideas of how we can help. So it might not seem like it makes a lot of sense at the time, but that's how we make these connections. So I encourage you to do that. And let's see, I think that was about it. So I'll let Dr. Prakash answer the questions. But we really appreciate you participating, and we hope that the registry is really helpful to you. And the reason that we did it in the first place is we don't want everybody asking you the same questions over and over, and then you get tired of answering. So we kind of help with that. If it's a duplicate question, we ask somebody not to ask that, and we've already provided that. So we hope that you enjoy it, and if you have any questions about the registry, feel free to call us and email us and let us know.
Great, thank you. Actually, if 10 people ask the same question, that tells us it's really important. Okay, so keep asking the questions even if you think somebody else has it. Also, if you think you're the only person who has the question, you're probably wrong. Probably somebody else in the room, at least one other person has that question. So we really learn a lot from these. Is the research registry for Americans? Unfortunately, it is at the moment still for Americans. I got asked that question yesterday by a European, actually. And logistically, it's difficult, right, for us to expand. But maybe Cindy could say something. Do you have any updates on that?
They can join.
Yeah.
We just haven't had the studies.
Right.
We let them join.
Yeah, so the official position is anybody can join the registry because it's on the web. We just may not be able to conduct all the studies with them because sometimes that requires permissions, to get other health records, and that's complicated when you're talking about some other countries. But certainly they could join and they could fill out surveys, for instance. All right. Where should I direct my clinician to go see the latest in TS research? Okay, so we are, one way that is reflected is in the new guidelines, because all the research that came out since the old guidelines is put into the new guidelines. So in terms of publications, that is probably, since it just came out, that's probably one of the easiest ways to get up-to-date information about TS research. As a society, I think we should, one of the things we talked about is to do updates to you all about research that's going on, and we're trying to do a better job of that. In the newsletters, you might have noticed, if you subscribe to the newsletter, there are updates about ongoing projects and also calls for participation. So if you do see the newsletter, please let us, contact us if you want to participate in some of the ongoing research. We also try to provide some feedback and updates. Is there any research cause of TS, or is it simply by chance? So there are people like geneticists who theorize about why TS occurs and have tested some of those theories. The answer is that it's a random problem when chromosomes don't move the way they're supposed to as cells divide. And it can happen in any time a cell divides. And if it happens to divide, it happens to an egg or an early embryo, it can cause Turner syndrome. So it's a combination of chance and timing. And in terms of why it happens, we have a lot of theories, but no one has conclusively proven exactly what causes it at this point. We certainly hope that in the future, that's another area that we can learn more about. Does TS affect breast cancer risk? It can, yes. So there are an increased risks for certain types of malignancies associated with TS, but not all of them, and the data is conflicting. So we do know, for example, that certain types of skin cancers are more common in people with TS. And we think that's related to changes in the immune function that happen in Turner syndrome. But the exact cause is not clear, and not all cancers appear to be increased. So we're still learning a lot about that as well. And it's not clear, for example, if having TS should be considered a risk factor for cancer treatment. That's another goal that we should probably try to achieve, is finding some certainty about whether or not having TS would affect your plan to treat cancer or not. Are there any mental health studies going on about TS aside from ADHD? Well, we have the neurocognition study, as I mentioned. That is for people who had exome sequence. In the future, it might be expanded, in which case we would invite everyone to participate in neurocognition. There's certainly a lot of ongoing research about how the brain works in TS, and it is not, and that includes mood disorders like anxiety. So stay tuned for that, because we will certainly have more opportunities for mental health research coming up. At last year's conference, there was a presentation on research about abnormal cells. Yes, I provided an update about that at the TS and aorta event this morning, and heart health, and it is still ongoing, and we have some new findings from that study. So if anyone's interested, I'm happy to talk to you about that later. If you have a family history of heart or diabetes and have Turner syndrome, can you be more at risk? Yes, so Turner syndrome is a risk factor by itself, even without family history, for diabetes and high blood pressure. So as well, and those things put people with Turner syndrome at higher risk for heart attacks and strokes, even if you don't have a family history. If you have a family history, there's some evidence that the two work together to increase the risk. So that's something that we often ask. And it may be that people with Turner syndrome experience heart attacks and strokes at slightly younger ages than they would otherwise. Has heredity been looked at further? Yes, there are some rare cases where Turner syndrome is inherited. I get asked this question a lot, but they're extremely rare. They're the kind where we would publish them in a journal if we had multiple people with Turner syndrome in one family. There are certain situations that make that possible, but the vast majority, like 99%, are not inherited. So it's very difficult to say that that is a significant concern with Turner syndrome. The risk of inheritance is really, really low. Is there any research on the effects of estrogen or the effects of ADHD medications? So we are hoping to do research on the effects of estrogen and progestin, as I mentioned, starting with the estrogen experience survey. It does also ask about progestin, because we think that the dose or route of estrogen affects mood and cognition, and we want to be able to do a trial to figure out how to optimize that for people who are taking lifelong hormone therapy. And then ADHD medications. Right now, as far as we are doing in the registry, there isn't an ongoing study, but again, with the neurocognition, that is also an area of interest. So we want to know how those affect your thinking, the way the brain works. I would like to see research or know more about autoimmune disease. Yes, that's another really unexplored area of Turner syndrome. We just got a proposal for the Scientific Advisory Board, as Cindy Scurlock mentioned. We receive research proposals regularly about autoimmune disease. And so you might be hearing a question about participating in a study of autoimmune disease in Turner syndrome very soon. How do researchers learn about the registry? What is being done to advertise? So we have done a lot to advertise the registry. We published 2 articles about the registry in the scientific literature, so people can find it. When they look for Turner syndrome registry, it shows up. We also advertise it in our clinic, so if people are looking for Turner syndrome care, they're encouraged to participate in research. And whenever we collaborate with other Turner syndrome experts across the country, we'll encourage them to join the registry because we want them to refer it to their patients. So that's how we're promoting it. Obviously, we can do more, and if you have ideas on how you would like to promote it to the community, then we would definitely listen, because I think there's no one more powerful to promote it than someone who's living with Turner syndrome. So if you're interested. Yeah. How we're promoting it to scientists? Yes, usually through the scientific literature and at conferences when we talk about Turner syndrome. So we'll be presenting some work on our cells, on our cell experiments about bicuspid valve at a major heart conference this fall, and we'll be talking about the registry, because a lot of people don't know about the registry still in the heart world. Okay. Can you tell us more about updates to clinic guidelines? Are there any you find that we should be most aware of in general? Yes. So I mentioned I wasn't going to spend a lot of time on the clinic guidelines because I talked about them this morning, but I did show some slides which I believe will be available on the website. So we posted about the key takeaways from the guidelines for you all. And one of the most important ones is there is now a regular set of times when you should see a cardiologist and reasons why you should see a cardiologist that are part of the guidelines. So all of the doctors who might refer you to a cardiologist will see that, and you can also be sure that that will be published in a format for patients. So you will be able to have a checklist. If I have these things, I need to see a cardiologist. It's meant to be much clearer than the old guidelines, where it was left up to the referring doctors quite a bit. Okay. And when are the new guidelines? They're available now. They're out. They are very long and very dense, so I wouldn't necessarily recommend reading them from cover to cover. They're about 270 pages, and they cover all aspects of Turner syndrome, besides not just cardiology, obviously, things like endocrinology, immune function, everything that we know, and there are lots of references, but all the evidence is there. All right, any other questions?
We're also going to take the guidelines that we have, the patient version, and create an insert of the newest updates that are
Yes. I know that the guidelines group in Denmark is working on a patient version that will be published worldwide. They're saying September, October. So in a couple months, you should start seeing something about a patient-friendly version of the guidelines. We might need to adapt it a little bit for here because some of the guidelines recommendations may differ a little bit, but we will definitely have a patient version up by the end of the year. Okay. Where do we go for a copy? Well, the guidelines are freely downloadable. They are on the internet. It is it's a big PDF document. I have a copy. We can post it. Can we post it? The guidelines? Yeah. So can we have a link to it on the website or? Yeah, they are? Good. So they're on the website already. Under resources. You can find a link to the new version of the guidelines and download it. Okay. Any other questions?
On the website, it's not a fancy cover, it looks like a journal article.
Yes, it's a journal article. It looks very dense. It's very hard to read. So that's why we need the patient version, obviously. But all the information is already there for you if you want it. Yes?
Do you recommend giving our doctors the long version or warn them that it's long, or giving the patient version so they have something?
So a couple of us are worried about that they're a little too dense, even for the doctors. They'll probably not read them. So for example, our group is working on a cardiovascular, heart-specific spin-off article that is just on heart issues, and it's going to include a patient-friendly version of the heart guidelines. So we're going to do our own thing. It's a group of us who worked on the guidelines and wanted to do it just for heart. I'm not sure if they're doing it for every area, but I can tell you that should be available. It's supposed to be done in October, but it should be available again by the end of the year. Would you be interested in a guideline app and a place to record completion of appointments? That's the question. The number is 162-555-987 for VVOX. Any more research ideas is the question. Now that you've heard a few things that are going on, maybe you have more suggestions. We'll take all the suggestions. Even if we don't get them here, you can get in touch with us, and we're always looking for more ideas. That's how we inspire the next generation of scientists. Lymphedema, yes. We have a group that's interested in lymphedema, and we're planning, if things line up, to do a lymphedema study here in the next 2 years, but it's too early to say if that's definitely going to happen yet. Fine-tune estrogen dosage, that again is what the estrogen study is about. So if we launch this clinical study, we want to get information about what doses you're taking, and then we'll try to figure out if there's a way to test whether different doses make a difference. Dental, we actually have a dentist who's interested in Turner syndrome, so I'll let him know that you have a dental-related question. Ozempic, we had a question about that one in one of the other sessions. And non-classical variants, that's really important. So knowing your karyotype and being able to put that into the registry accurately is going to help us answer questions about the difference between karyotypes. So if you can upload your karyotype, I think we're still offering the $20 gift card. So when you complete the new survey, there's a place to upload your karyotype report. If we get documentation of your karyotype, we'll give you $20. Let's see. Hormone replacement, lots on those. A Y chromosome material, so we still are interested in Y material. Again, knowing your karyotype will help us know who definitely has Y material. Sometimes if you have a Y test report, you can submit it with your karyotype. That tells us who we should ask about Y chromosome related issues. All right, brain structure, yes. Brain scans are included in some of the studies that have been proposed so far, and I expect that that will move forward, so you may be asked to participate in a brain structure study. Autoimmune again, good. Yes, so the outreach to non-white, non-English speaking participants is a major priority. We recognize that the registry is almost 90% white, and that's not acceptable in today's research environment. It has been challenging, of course, the way the registry is built out to reach other audiences, and we are continuously striving to improve. One way is with the new Spanish language registries, which we'll try to circulate as widely as possible. And another way, of course, is to find new audiences for our surveys. So trying to reach out on social media, doing other kinds of formats, that's something that we're constantly talking about getting better at. But that is an important thing because everyone's experience is slightly different. Hearing loss, I heard that how inadequate hearing aid technology is for many people, and we understand that should get better, but it is frustrating. And I think this community, it would be an ideal scenario for some company who wants to improve the technology to work with. Let's see. Complications during pregnancy, that is really important, and that's one of the reasons why we launched the prenatal survey. So if you fill out the prenatal survey, it will talk about pregnancy of a fetus with Turner syndrome and any maternal and fetal complications. We really need to know that. There's virtually nothing about that in the scientific literature. So this is our opportunity to fill in that blank. Fertility and how it impacts the individual, parental fertility, and how it impacts the TS individual. Okay, so fertility issues in general have been at the top of the list for a while, and there are many new options, including new treatments that are still being experimental. It's still being tested. As those move forward, we will probably see more studies about fertility. All right, let's see, psychiatry. So lots about psychiatry and brain function. I think these are, we're definitely trending in that direction, with mental health being a priority in general and specifically in Turner syndrome. Malaria having TS, okay? Malaria, mental health. So these are great, and we really appreciate your input. Yes?
Yeah, I'm sorry, my phone's broken. I do have a comment. I was talking to Bob, the lone gentleman among us, and he was telling me that somebody started a Facebook group for men with Turner syndrome.
Yes, so...
And I asked him, and he says, you might think that there's not too many. He says there's like 100 members.
Mm-hmm.
And I'm like, well, where are the men then? Let's tell them to come invade the women here. You know?
Yeah, so as you know, for a long time,
Other
the...
athletes and
Yes. Yeah, so as you might know, for a long time, Turner syndrome has been defined as being a phenotypic female. So regardless of the sex chromosomes, the official definition is still that way. And that's why you don't see a lot of males here. There are males with the same karyotype as females. They happen to have a bit of Y material that was enough to form testes and not ovaries. And it was in the right place at the right time. So it is relatively uncommon compared to the incidence of XX females with Y material, but it's still a significant number of individuals, and there have been discussions about including them. We haven't reached a consensus yet. There's still quite a bit of division in the medical community, and that may change, but that's another thing that we expect will change with the next guidelines. Just hasn't changed yet. So stay tuned on that. Anyone else? Oh, yes. Any specialist who can remove extra skin on the neck? Yes. There are plastic surgeons who can do that, and some of them actually specialize in that kind of surgery, typically at larger centers. But a plastic surgeon is the kind of person that you probably want to look at for that question.
Will you let people know that if they have had that procedure,
Yes.
contact us, we'll add their surgeon to the physician's directory, or if they have good doctors,
Yes.
so that people can find people that are...
Yes. Yeah, so what Cindy Scurlock said was, if you have a good physicians, particularly for something that maybe is not that common, like an extra skin, removing extra skin from the neck, like she asked, please send it to the society so that we can post it on the website, because we want a directory of physicians that really care and do a good job with Turner syndrome so that other people can use them as resources. That is really important for the community. So if you can help build that, it would be great for all of us. Anything else? Oh, okay. Are we moving to a regular cadence for guideline review? So the answer is probably. We are talking about doing another one in 5 years, but a lot of these things have to do with the funding and logistics because, as I mentioned, it takes to get representatives around the world to meet in one place at one time and agree on guidelines is no small feat. So we're hoping that it will happen every 5 years. This one got a little delayed, but in general, if it's less than 5 years, to be honest, it's not worth the tremendous effort to make the guidelines because we really have to put a lot of effort in compiling the information. So I wouldn't say it's going to be more often than 5 years. Thyroid regulation and medication. So a question about that is research. Yeah, we don't hear a lot about thyroid, but thyroid is surprisingly, it's surprising to me because thyroid is so common. And certainly not everyone has a great outcome with thyroid medication. So I'm sure there's a question there that we can do better. Where do we go for a copy of the guidelines? We answered that one. It is on the turnersyndrome.org website. You can find it under resources and download it. And the patient version is in the lobby, so you can even pick up one before you go. Okay. Any other questions? Did we wear you out? Thank you. Sure.